Hey guys, this is Dr. Shivaam. I'm a young and aspiring ENT and head neck surgeon who is making videos and teaching you all through this YouTube channel. So your AIMS examination dates have been announced and I am planning to give my part in your preparation by this regular short videos which will help you to get the concepts for your future examination. So mostly your exams are based on the concepts. Those old habits of going through the guidebooks of objective questions is over now. So until and unless you develop the new insight, the new conceptual mode, it is difficult to excel from others. So these short videos will be focused over this. So do shares with your juniors, with your colleagues, whoever are in this race. And our today's topic of discussion is JNA, juvenile nasal angiofibroma, right? So moving to our topic for today, that is JNA, right? So initially you have to know what is the common things, right? From JNA, what are the common points, and then we can see what future questions can be asked from it. So if you summarize your whole JNA topic into 7 points, the 7 most important points that you need to know are: number one, if you can see, it's written benign, B for benign, so it's a benign lesion. Number 2, it is written here 14-year and male. That means this tumor is a testosterone dependent tumor, right? So this tumor is more commonly seen in male population, and the peculiar age that is associated is 14 years of age, right? Okay, then the third thing that you can see here is it is written epistaxis. So most common symptom is epistaxis, and or you can say the most common sign is epistaxis and most common symptom is nasal obstruction, right? Now here the fourth point is the site of origin. So the site of origin is sphenopalatine foramen. If you see here in this diagram, not the diagram but a CT scan of nose and paranasal sinus, you will mark a point that is sphenopalatine foramen, right? So the peculiar finding that I wanted to discuss is widening of this sphenopalatine foramen. So lot more students ask me how we will differentiate our nasal polyp from this JNA. So there are certain CT features. A separate video I have done for it, I'll post the link below, but here you need to mark two things. One is it will be contrast enhancing, so it is a vascular tumor, right? Why vascular? Because basically the origin is from, so this is one of your future question, the origin is from first brachial arch remnant. So note this, the origin of JNA is from first brachial arch remnant, that is sphenopalatine artery, right? So in the recent Scott Brown, the recent and the accepted theory is first brachial arch anomaly, right? And this sphenopalatine artery is the first brachial arch artery, means a part of maxillary artery, the third part of internal maxillary artery, IMA, gives rise to this sphenopalatine artery, which is the cause of this JNA, right? And this sphenopalatine artery is present in the sphenopalatine foramen. That is why the origin is at sphenopalatine foramen, and this is why we get widening of sphenopalatine foramen in the CT scan of nose and paranasal sinus. So very important point, before you operate on any nasal mass, you have to rule out JNA because the management differs. It is highly vascular tumor, and why we fear operating this tumor is its tendency to bleed, right, and difficult to manage. Why difficult to manage? We operate so many vascular tumor, but we don't fear. But this tumor we fear due to bleeding. We take blood from beforehand because this tumor on histology lacks a layer in the endothelium, and that layer is tunica media. So this JNA lacks tunica media in the endothelium layer. That is why this tumor, the vessels cannot contract, cannot go into spasm to stop the bleeding. So normally the blood vessels undergo spasm due to sympathetic stimulation so that the bleeding stops, but the JNA, this tunica media is absent, and that is why they cannot contract, the blood vessels cannot contract to stop the bleeding, right? The important point to note is widening of sphenopalatine foramen. So if in MCQ also you get this widening of sphenopalatine foramen, or you get this CT scan image. So let us see some more CT scan images which will make you this point more clear. So see this one. So this is a diagnostic nasal endoscopy which is showing you somewhat a vascular pinkish mass. So this will help you to differentiate with the polyp, and the widening that I was talking about is again seen here. So if you mind both the sided sphenopalatine foramen, so just see, this is your left side sphenopalatine foramen between these two bones, right? And mind this sphenopalatine foramen. So you will observe that your right sided sphenopalatine foramen is widened, right? So sphenopalatine foramen is located just behind the posterior wall of maxillary sinus. So once your in CT scans, once your maxillary sinus disappear, your sphenopalatine foramen and the pterygopalatine fossa region appears, right? So you need not to go into that depth, but just know that there is widening of sphenopalatine foramen. Just compare the left from right and you will get this point, right? So this point is pretty clear. Now moving to your other CT scan finding that they ask is your Hallman-Miller sign, right? So bulging of posterior maxillary wall, which is seen on the X-ray or CT scan. And why this bulging is seen? Because this tumor is present behind the posterior wall of maxilla, right? So this will cause bulging of posterior maxillary wall, and you see Hallman-Miller sign or antral sign. So lot more MCQs this tumor is covering for you, right? Now regarding the treatment, so if you can see this treatment, the treatment is surgical. So you need to remove this tumor, but before going towards surgery, many a times if the tumor is large, or for theoretical purpose, you can give the tumor chemotherapy or hormonal therapy, right? So chemotherapy, the MCQ, for sake of MCQ, the chemotherapy is vincristine. In MCQ if they ask, the chemotherapy is vincristine. The hormonal therapy is flutamide. Why? Because it is a testosterone dependent tumor, right? Vincristine chemotherapy, flutamide is hormonal therapy, and finally the treatment of choice is surgery. And surgery, what surgery? Endoscopic sinus surgery. So most of the tumor in a skilled ENT surgeon, it can be removed endoscopically, right? Although there are several modes of its removal. Now if you want to see some of those, there are different modes of its removal. It can be open approaches like your this incision. So coming to it, so you can give different types of incision, external for external approach, and mostly nowadays it is done endoscopically. One surgery that I had done during my initial PG days was transpalatal. So there is also, so this was the external approach, lateral rhinotomy. You give the lateral rhinotomy, do the maxillary swing and remove it. But these are now rarely done because we have so advanced instrument in endoscopy, so you can remove it with the endoscope only, right? And if you want this PDF, do join the Telegram channel that I'll post the link below, and you will get this PDF so that you can get a pretty good idea. So you can see here the JNA being removed through the oral cavity, and this was the thing that I was talking about, the transpalatal approach of JNA. But you have to remember the treatment of choice is the endoscopic route, right? Endoscopic route. And one more thing is, just for the sake of MCQ, just know that the other tumor that is important for you is nasopharyngeal carcinoma, right? So you need to differentiate your JNA from nasopharyngeal carcinoma. So if anyway you need to remember some points for nasopharyngeal carcinoma, just know that this NPC is a malignant lesion. That was benign, it is malignant, right? Most common symptom and signs. So most common symptom in case of this NPC will be your cervical lymphadenopathy, or you can say your nasal obstruction, but the most common sign will be your cervical lymphadenopathy, right? And the second will be your epistaxis. Now most common site in case of JNA was sphenopalatine foramen, but here in case of nasopharyngeal carcinoma it is your fossa of Rosenmuller. So this was asked in one of your recent exam of NBE. It is fossa of Rosenmuller. So I am sweating, I am just under the fan so that the sweat gets dissolved. Right now you were doing CT scan as a treatment of choice because biopsy, as the investigation of choice, because biopsy was contraindicated in JNA, vascular tumor. So you were doing CT scan and getting Holmer-Miller sign. Here you will do MRI. In nasopharyngeal carcinoma, which is a malignant lesion, have a bimodal presentation because that JNA was showing 14 years. Here in NPC you will get a bimodal presentation, means it can be found either at 20 years or 40 years. So bimodal presentation. Site is fossa of Rosenmuller. That was sphenopalatine foramen. Here the investigation of choice is MRI. There it was CT scan. Here in nasopharyngeal carcinoma the treatment of choice is your radiation therapy because it is very radiosensitive tumor. Nasopharyngeal carcinoma, radiotherapy, but there it was surgery. So these were a lot more important points that you need to remember, be it the concept wise or be it your MCQ wise, because this all will help you to revise your things pretty fast and solve all the related MCQs that can be asked in future, right? So showing you some more CT scan picture to give you a better and pretty clear idea. So again, here on the CT scan of nose and paranasal sinus, you can see your tumor, which is JNA. Why JNA? Because now you all can see that again there is widening of sphenopalatine foramen. And if I ask you what cut it is, so I will suggest you to watch that CT scan video again. That link I'll post. Otherwise I'll again make a short descriptive video of CT scan, because in your AIMS examination they had given this CT scan of nose and paranasal sinus, and as they are more into clinical, again they will give something with it, right? So you need to have a clear and a wholesome idea of any topic which you are reading. Only anatomy, only physiology, only pathology is not going to work now, right? So if you are reading something, you should have a wholesome idea, starting from the origin, from the embryology to the anatomy to the physiology, pathology, investigation, and then the treatment of choice, right? So Dr.